India is in the middle of possibly the biggest crisis it has ever faced. There isn't a home or a family we know who hasn't suffered personal bereavement, whether in its immediate or extended family. Every day we hear stories of deaths and suffering, and it is just alarmingly increasing day by day. What do you say to a daughter who has lost a father because the oxygen supply at the hospital ran out? What do you say about the fact that patients are now carrying oxygen cylinders like tiffin boxes when they walk into hospitals? What do you say about the fact that we are now a country with oxygen langars at our gurudwaras? Parking lots have turned into hospital beds and crematoriums. The country is standing like a great statue and looking up to the building of a temple to overcome this crisis. Doctors and nurses, on the other hand, are working overtime without ever pausing to say, "We told you so." Welcome to Disaster Made in India.
ये पूरी धरती तो बचाता है, मेरी अर्ज नहीं ये सुनकर घर बिठाता है। कोविशील्ड है कहाँ रे तू, कोवैक्सीन है कहाँ रे तू।
In the middle of all this, many things that we saw over the last couple of months can be best described as bizarre. Like the continuation of the IPL in a bubble of its own. Well, that bubble is now literally and metaphorically broken, and IPL has been suspended. Although there has been a debate of whether it has been made a soft target because, unlike election rallies, it is at least not physically dangerous for the spread of the virus. Local elections in UP were never paused. State elections in 4 other states and 1 union territory were not postponed. We saw people crowding around with absolutely no COVID appropriate behavior being exhibited at any moment by anyone. Okay, people who advocate for democracy may say that elections are required. Okay, fair enough. At the same time, we preponed the Kumbh festival from next year to this year after listening to some astrologers' mumbo jumbo about Sun entering Aries or Jupiter entering Aquarius. To be honest, these rocky planets and stars don't care about us humans. Sadly, we ourselves don't seem to care for each other. We could have easily stopped the congregation so as not to endanger the lives of millions of people by causing a super spreader event for COVID-19. We could have done it next year and could have used the time to create the conditions where holding an event like the Kumbh could have made some kind of sense. Maybe in 2022. The result? More than 5,000 people were identified as COVID positive by mid-April, and some reports say 99% of Kumbh Mela returnees from Haridwar were found to be infected. Of course, these kind of numbers don't show up in the media. One saint was purportedly reported as saying that death was inevitable, but we must maintain our traditions. Yes, the news that a 9th saint has left for his abode due to COVID should be pleasing to them, not for us. So in a country steeped in a false pride of traditions and superstition with lack of scientific temper, political rallies, religious congregations, and an apathy towards anything modern, viruses like corona can have the time of its life. This is where some of us need to discuss hard data and accept the fact that some of this was definitely unavoidable, but some were definitely avoidable. Even though it will not make the misery better by saying this, but let us understand why we are in this situation today and why some of this could have been avoided. We strongly feel that the misery this second wave of COVID is creating could have been avoided. Second wave could not have been avoided, yes, but the extent of the misery could have been. We will tell you why. In January of 2020, one company, BioNTech, started making a vaccine. In March 2020, a company called Fosun Pharma of China put 135 million, which is around 1,000 crores, in BioNTech to kind of take a bet on the vaccine. to make sure they had the license if the vaccine gets approved and they can use it in China. And this is what they are using there today. In April of 2020, Pfizer put 150 million in BioNTech. In June 2020, European Commission put money in it. In September 2020, Germany put 500 million on that same vaccine. We are not by any chance advocating the Pfizer vaccines. All we are saying is that all vaccines, Pfizer, Moderna, Johnson & Johnson, etc., have the same story. Countries partnered up. Europe, US, China, they all partnered up in March to September last year, and once the vaccine was available, they had enough of it and can easily distribute. Now let us see what we were doing during the time. In March, we were banging plates, lighting diyas, bursting crackers, trying to find the killers of a Bollywood celebrity and investigating the drug nexus among Bollywood. This is not funny. This is what the top headlines were. This was when all over the world people were putting money in these vaccines and securing supply for their respective countries. We did not. By dumb luck, Serum Institute had a deal with AstraZeneca to manufacture 1 billion doses of vaccine for them. So, Serum Institute of Pune, which is a private entity, had an agreement with them that they would do so, but around 10% of this would be for India. Now, most of the Indians who have got the vaccine by now was due to this deal, which was pure dumb luck. India did not collaborate with any of the foreign vaccine developers, did not tell AstraZeneca that if we will be making 1 billion doses for you while making 1 billion doses for India too. We did not do all that, and it seems we did not care. We were having the typical Indian mentality that let someone else make the vaccine and get it approved. Then let us see. Kuch na kuch jugaad ho hi jayega. In December 2020, vaccine started to get approvals, and all those countries who tied up started getting it. Pfizer came to India and applied for the approval. But what did we do? We gave them a long list of homework for them to do. Now, you can say it was justified, but we knew that Europe and US had approved this vaccine, and by this time they had already started to use this on their public. But we gave them so much to do. By February 2021, they said they don't need our approval and they are out of here. Same examples can be given for other vaccines like Moderna. Even AstraZeneca, we did not do any deal with them. A private company did a manufacturing deal with them, and a small portion that got ensured that some of our senior citizens were vaccinated with it. Rest we had to send out of the country as per the agreements with the companies. The major reason for why there is such a careless attitude is because we don't believe in science. We think what is in the Vedas, scriptures, history is science. Having a scientific temper means the first thing we say is that we do not know. We need to work and discover. Therefore, if top pharma companies of the world are researching a vaccine, we need to partner up with them because we don't know. We should respect them in their work rather than saying they are all capitalist and greedy monsters. We don't understand capitalism and we don't understand science, and that is what is needed to be part of these big vaccine companies. December 2020, when people were coming to us with approvals, we got into this Swadeshi mode. It is not enough to just have our own vaccine. It's okay, we have a decent vaccine. Yes, it's a good vaccine. But that is like saying you have a marriage in the house, but you say you are not going to hire a caterer because your mother can make really good rotis. And how dare you question my mother? And that caterer is a profit-making, money-making guy. He doesn't make it with so much love as my mom makes it. Okay, fine. But your mother can make 10 rotis in the kitchen, but we have 1,000 guests, so you need a caterer. In this marriage, for example, the guest only will go back hungry. Fine. But here, people who are unvaccinated are getting sick and dying. Imagine how big medical infrastructures collapse, and we are facing that today as something as basic as oxygen is not available in hospitals. Now this is not at all complicated. It is just understanding simple data. We have 140 crore people in our country. We should be ready to vaccinate around 100 crore for herd immunity. That means we need 200 crore vaccine doses. Serum gave us around 10, and just recently government has ordered for another 15 or 20 more, which is just an order as of now. So if we combine these two, it is just around 30 crore doses, which is nowhere near to the 200 crore doses we need. Bharat Biotech making Covaxin is a small player here who can approximately make around 30 crore doses in a year. What do we need? 200 crore doses in 3 months. We would need the caterer to help. Your mother, however amazing she is, won't be able to make this. This basic fact we all will need to understand and accept. We as a country has the money to pay for the vaccines, but we don't have the vaccines. Indian virologist and academic Dr. Shahid Jamil states that India has lost the plot. He explains how a vaccine in a pandemic is supposed to save lives and to cut short the pandemic. When we started to roll out the vaccine, it was good as we aimed at protecting all the healthcare and frontline workers and also people above 60 where the mortality rate was highest. Unfortunately, there was a time when we were on a downward slope, and during that time there were concerns about blood clots in Europe after vaccination. So that led to a lot of hesitation among people who should have been vaccinated by the time and did not end up taking the vaccine. So after all these apprehensions were cleared, now there is this huge rush in getting the vaccines. Then there is also a supply shortage now, which the government should have planned in a much better way, since it was always clear of how many doses we would require as a country and by what date. Now the situation is such that if India wants to vaccinate everyone above 18 during this year, we will need to roll out 75 lakh doses every single day. We are at an average of 25 lakhs per day as of now. At one point, we had gone up to 40, but never gone beyond that. So this is a very huge task now, and the supply chain is the biggest issue right now. Dr. Jamil also says that if we think we are going to control the second wave with the vaccine, we are sadly mistaken. The time for that is over. Let us look at this logically. If somebody started to get the vaccine today, that person will be fully protected in 6 to 8 weeks. That person will not be protected tomorrow. So to cut transmission, to reduce the impact of this wave, you would need time from a vaccine perspective. What the vaccine will do, if taken now, is to reduce the magnitude or postpone the third wave. So the vaccine is for the future. For it to reduce the impact of the second wave, we should have taken this by Jan or Feb this year, and sadly we missed the boat. So the only option that we have right now is for the authorities to ensure proper medical facilities like hospital beds and oxygen supply to reduce the number of fatalities when the third wave strikes. We are yet to see the peak of the second wave as we make this video, and we are already talking about the third wave. Yes, most likely that would come sooner than later. The upward spike of infections during a pandemic is always steeper than the downward fall. That is because it is easier to get infected than to recover. Recovery usually takes 14 days, whereas getting infected might happen in 14 seconds. Today, we don't even test the number of people as we did earlier, as the testing facilities can't cope with the number of people lining up for knowing if they are carrying the virus or not. Less testing, less numbers, but the infections could continue to surge unabated whether we report it or not. The virus unfortunately doesn't understand the numbers as we do. It just knows how to multiply. Numbers are for us, and the more we hide them, the more we would be exposed at the end of it all. People who scoff evolution may not understand this, but what we are seeing right now is the proof that you have been asking for. The longer the second wave lasts, the greater are the chances for the virus to mutate into something even more dangerous. And when it does, the current vaccines may not work. So the third wave may be even more dangerous. Forget double masking. We might have to resort to wearing something like this. So we have seen 2 waves now. Have we learnt anything? Sadly, apparently nothing. Would we complete the syllabus before the third wave starts? Highly unlikely. We can skip the question saying that it is out of syllabus, but this is one exam that we want to pass. Failure in this exam means the collective failure of humanity. Blame the government or blame the people. The end result is what matters. The message was so simple that even a 5-year-old could understand. Wear a mask properly, covering nose and mouth. Sanitize hands and maintain social distancing and avoid crowding. Only our mouths were locked. Our eyes could still see and our brains could still think. But we chose to keep our mouths locked, eyes shut, and our brains under lockdown. We would like to end by saying that believe in science. When you lose track of science, when you lose track of data and numbers, that is when you get caught in the politics, rhetoric, and the left wing versus right wing, and that is when you get into crap. And none of this matters. All that matters is facts, data, science, and most importantly, life. Hope to see you soon, unless the virus catches up to me.